everybody. My name is Dr. Juhi Dhanawat. I'm a consultant gynecologist at Bhagirathi, Neotia, RAWDON Street. Today I'm going to talk about a very interesting topic called menopause. Most of you have heard the term menopause, although we are actually not very clear with what it is, when does it start, what kind of symptoms we experience, and when to see the doctor. Is it safe to take medicines? Are there any alternative treatment other than taking those pills which are prescribed by gynecologists? So I will be talking about all of this in brief so that you have a basic idea about it. Okay. Menopause, the average age of menopause is 51 years old. It is a normal phenomenon in a woman's body. We actually say that menopause has been attained when a woman does not get her periods for 12 months and she is reasonably not pregnant. So, but when does the symptoms come? Just per se, if you're not getting your periods, does not mean that there is some problem in your body. Here we are talking about the other symptoms which are associated with it, which make our normal general day-to-day life uncomfortable. So the perimenopausal period starts from the age of 40. It is almost approximately 10 years, wherein you experience all other different kinds of symptoms, which I will be talking shortly. There is something called pre-menopause, which in this particular phase, you have your hormones in the body going down, but you don't have symptoms of it. So basically you have a pre-menopause phase from the age of 35 to 40 roughly. You have a perimenopausal phase from the age of 40 to 50, and approximately after the age of 50-51, when you do not get your periods for 12 months, we say that you have attained menopause. Why does this happen? This is because of the hormonal shift in a woman's body, which is a normal natural phenomenon that is there. So our basic female hormones that we say, estrogen and progesterone, those particular hormones in the body, they start going down after the age of 35. Then from 35 to roughly about 45, 48, the hormones are very irregular. And slowly after that, it completely goes down to a complete stop, to a bare minimum. So when it goes to complete stop, we women, we don't ovulate. And since we have no hormones, we don't menstruate also. Okay. So what are the symptoms that we look for in menopause, or when should you think that, okay, I may be having a perimenopausal symptoms? So basically you might be getting irregular period. Now after the age of say 38, 39, a lot of women come to us in the OPD saying I have heavy bleeding, saying I have irregular periods. Sometimes in a month I get 3 times, sometimes I don't get it for 2 to 3 months. Sometimes it is associated with pain. These are the changes these are irregular period changes due to the change of hormonal shift in the body. So that is one thing. So when you come to us with such a problem, you should first monitor how your menstrual cycles for the next 3 to 4 months before we start giving you any kind of tablets to regulate your period, because for all I know that this irregular period may be a normal phenomenon in your body rather than a particular disease. Okay, other symptoms, very common symptom of menopause is vaginal dryness. Vaginal dryness happens because now the estrogen in our body is less, our pH of our vagina changes, and therefore it becomes very dry, the skin becomes lax, it is more prone to infection. So you have repeated vaginal infections, burning sensations, repeated urinary tract infections. During intercourse you might experience some kind of burning. Third very common symptom is hot flashes, matlab thanda garam hona, meaning suddenly you are sitting and you are feeling extremely cold, and then in the next minute you are sweating and feeling really hot and you need the air condition on. Those things are called hot flashes. Sometimes these hot flashes convert into night sweats. During the day you don't have anything, but at night you feel that your bedsheet is totally wet because of the sweat that your body is perspiring so badly. This happens because there is a core shift in the body temperature in a woman's body due to the fall of hormones in the body. You might be having some sleep problems, not able to sleep well at night, and some anxiety, mood swings, headaches. Okay, after a certain period, you might be getting, you'll feel that your body is increasing weight, hips, especially on your hips, your tummy, breast size increasing. All of this is because when our body metabolism becomes very slow when we are nearing towards menopause, and after menopause, since the metabolism is very slow, we tend to gain a lot of weight. So in spite of all of this, one thing we have to understand that as a woman we should accept this as a normal phenomenon in the body and not get too worried about it. If you are experiencing such a problem, you should see your local gynecologist. She will do a thorough checkup for you. She will do some breast checkup, some pelvic examination, maybe get an ultrasound to rule out whether there is some disease pathology like polyp or something like that. Polyp or a uterine fibroid for irregular period or pain. But if everything else is normal and you have no other problems, and if you have not had your period say for 12 months, or even if you are still having a regular period, you can take medicines to combat all of these problems depending upon which problem is majorly in you. Now there are multiple tablets and gels and creams that are available in the market to replace these hormones which are going down in the body in a regulated form, so that you experience all of these things less and you can bleed through your menopausal period in a safe way. So suppose if you are having a lot of vaginal dryness, you could be prescribed a vaginal estrogen cream. For hot flashes, you can take some hormone replacement therapy. And if you are these treatments, they vary depending upon what are your other medical problems like hypertension, diabetes, some liver or kidney problem. It also varies from which particular problem you have come with, which particular symptom of menopause you have come with. These kind of so it's important to have one-on-one chat with your gynecologist, and then we decide whether you need the hormone replacement therapy or no, how badly it is affecting your day-to-day life. And once you take it, and if you are on this hormone replacement therapy, you have to visit a doctor every 3 to 6 months for a regular checkup to see the side effects of these hormone replacement therapies. Fairly, these hormone replacement therapies are safe. It is good for the body, can be taken even up to good 10 years or before the age of 60, whichever is shorter. But there are some studies, evidence-based studies, which say that you may have an increased chances of breast cancer or a uterine cancer if you still have your uterus intact. So that depends. So you can discuss this with your gynecologist, and we can decide as to how many years you can take it, whether you should prolong it for even further time. There are multiple other drugs, alternative drugs, if you are not able to take a hormone replacement therapy, to help you decrease all of your menopausal symptoms. The other you have multiple alternative ways to keep your body fit after menopause or during the menopausal period. Like you should do regular exercise, yoga, you should meditate. We Indians, we have a very good tool, yoga, and if you actually utilize it, your menopausal symptoms decrease very, very drastically, because we are able to control our sympathetic nervous system if you are able to control your mind. So that is one very good thing. If you eat healthy, meaning the regular way, you don't eat processed food, you don't take alcohol, and you take a lot of soy in your food, you take a lot of fruits, vegetables, legumes, beans, let's say rajma, dal. Regular exercising is important, and trying to keep your mood happy, going to a place which makes you happy, avoiding the stressful stuff of your life. These things will help you to bleed through your menopausal period very smoothly. And once you start on treatment, and when you do these lifestyle changes, you will see that after a certain period, say 6 months to 1 year, these symptoms have reduced. And after that, depends upon, you can have a discussion with your gynecologist to say that whether you should continue with the drug or no. You can continue the drug for 2 years, you can take it for 5 years, you can take it for 10 years, depending upon your symptoms and whether you want it, how it is affecting your normal and personal life. So that's about it for menopause. And whether you take the hormone replacement therapy or you don't take the hormone replacement therapy, it is always advisable to have a check on your diet. Maybe you can visit a dietitian if you want a regulated diet, or at least you should have foods rich in calcium, foods rich in vitamin D. You should take beans, legumes, whole grains. Avoid processed food like cakes, chocolates. Avoid caffeine, coffee, tea, as much as you can reduce it. Avoid spicy food. And these are very small things, and and it's very good if you take at least 50 grams of soy product, because it is evidence based. It is said that Japanese people, they have a lot of soy in their food, and therefore they do not experience menopausal symptoms so much. And the reason is because of the soy, because soy has natural estrogen. So if you can add some soy to your food, you will see that your symptoms have gone down. So before you do anything, you can start by asking your doctor. You can ask certain questions so that you're absolutely clear with what kind of hormone replacement therapy you are having. So you should always discuss with your doctor your medical history, what kind of HRT you're going to be taking, what part of your symptom is it going to affect, what are the risks and possible side effects of hormone replacement therapy, what is the lowest dose that you can take. If you have one-on-one discussion with your gynecologist, I think it will be good, and you will be able to live a much more healthy and happy life, and menopause is not going to be a nuisance for you. You will understand that it is a normal thing, and within next 2 to 3 years you will feel absolutely fit. Thank you.